www.healthcmi.com. Acupuncture Continuing Education Online. Hello, I'm Adam White, licensed acupuncturist. Today, Acupuncture for Rheumatoid Arthritis Success. Look for this title at healthcmi.com. Simply click on News. This article was published August 29, 2019. Acupuncture is more effective for treating rheumatoid arthritis and improving markers of oxidative stress than pharmaceuticals. This research was conducted at Guangzhou University of Traditional Chinese Medicine Affiliated Hospital. Very interesting stuff. So not only did they look at the visual analog scale, in other words, symptoms, and there was tremendous symptomatic improvement in the acupuncture group, but also oxidative stress biomarkers reduced. So these biomarkers help to show changes in overall stress to the body, including damage to cells. And they are participatory in the pathology of rheumatoid arthritis. So getting a little bit of detailed, one of them, for example, is glutathione peroxidase. Another is superoxide dismutase, and several others. So they were measured, and basically oxidative stress describes increased levels of reactive oxygen species which damage cells and, again, contribute to destruction of the body, including joints and such in rheumatoid arthritis, even internal organs. So the total effective rate in the acupuncture group was 91.2%, and the drug group 76.5%. If we zoom in and take a look at the article, what we find is a very simple set of acupuncture points were given to everybody, and then based on presentation, extras were added. So it was Hegu, Zhusan Li, Sanyan Jiao, Guan Yuan, Qi Hai. So large intestine 4, stomach 36, spleen 6, CV4, CV6. Very straightforward. And then, depending whether it affected the elbow, wrist, knee, ankle, etc., they list very special secondary points to address those concerns. They even go into a special acupuncture technique used during this treatment called hot filling acupuncture, what type of needles were used, everything. So acupuncturists can really enjoy this. And then they also go into the drugs that we're giving, which were things like methotrexate and other drugs. So they really use strong medications to control the rheumatoid arthritis, so it's a fair comparison. Again, these drugs are a bit toxic, truthfully, so it's nice that we can get result without really getting into that. One of them was a COX-2 inhibitor, and that's also an interesting choice. And another one, leflunomide, is also an immunosuppressive, disease-modifying anti-rheumatic drug used for rheumatoid arthritis. So they pretty much, as we would say, pulled out the heavy guns of medication and compared that to acupuncture. They gave basically 4 weeks of treatment and a 3-month follow-up. And acupuncture did well. So if you want to take a look at the article and the references and all the details of the treatment and how many recovered and how many had a little bit of effect or market effect, you can see the article. Simply go to HealthCMI, click on News, and look for the article entitled Acupuncture for Rheumatoid Arthritis Success. So what's important about this article is drawing attention to this incredibly important topic, because anyone who has ever suffered from this or knows someone who suffers from this understands the gravity of this type of work. An acupuncturist cannot necessarily cure rheumatoid arthritis, but we can manage it and be part of the program that keeps it under control. Yes, dietary and lifestyle changes, maybe even medications, but by adding acupuncture in, it's simply an important component that can radically and beneficially alter someone's life. So in my own personal experience, I will say it can even be a little bit emotional. Having people come into my office flared up, barely able to move, barely able to get on the treatment table if I'm lucky, where I have to help them up. And then to see them just a few weeks later kind of hop up on the table and move around. It's fun. Like, well, do you feel any better? And it's almost like this joyous event because they're moving and they've got their elbows moving and their wrists moving, the legs. Yes, they run into flare ups from time to time. They're going to need more than acupuncture. They may need herbal medicine or other medicines. But acupuncture definitely serves an important part. And I would say so many of them have been ravaged by rheumatoid arthritis to the point where they're deficient, very weak internally, such that very gentle acupuncture is really a great approach. So those finer gauge needles, those lighter needle stimulations and fewer needles for those patients tend to do very well. Seemingly counterintuitive, you think you would do the stronger, more robust treatment, but in reality, when people are that deficient, sometimes the lighter treatments work better. So this has been my experience, especially when they've really been up against the ravages of rheumatoid arthritis for many years. So I like this article because it draws attention to this problem and that acupuncture is an important component in the management of rheumatoid arthritis. It's a very serious topic and something that, in my opinion, if someone has rheumatoid arthritis, they should not be without this service, or at least it is an important component as part of an overall treatment regimen. So again, take a look at the article, Acupuncture for Rheumatoid Arthritis, Success at healthcmi.com. Thank you for listening, www.healthcmi.com.